Welcome everybody this lovely Thursday at 5:30 before Memorial Day weekend. I would like to invite everyone to our talent talk for our cardiology department. What is Talent Talk? Talent Talk is a platform that we use to make sure that we get you guys all the information you need about a certain department. So when you're ready to start your nursing career, you will know exactly what to do, how to do, and why you are doing it. Talent Talk has been around for quite some time. I want to give Madison Quinn and Lauren Russell some credit for putting this together for us, and we are happy and excited for you to join us tonight. All right, questions. What I would like to ask, if you have any questions, please make sure that you use the chat room for any of your questions that you might have during this presentation. Also, no pressure, but if you would like to show yourself on your camera, that would be greatly appreciated. But we would really love for you to make sure that you ask questions in the chat. Sometimes it'll be questions that you don't think you want to ask, but no question is a bad question for us, and we will make sure that we will try to get those answered for you in a timely manner, okay? Let me tell you a little bit about myself. My name is Gary Ingram. I am a recruiter for perioperative services for HM Health Wake Forest Baptist. I have been recruiting for almost 3.5 years, and I love my job. As you can see on the slide, my contact number is 336-970-0473, and my email is also associated with that. So if you have any questions for myself at any time, feel free to reach out to me. I have been transitioned from a different recruitment process over to the healthcare system, and HM Health Wake Forest Baptist is the place that I know I should be, which I know that's where some of you guys are going to be. But I am so excited about kicking this talent talk off for you guys on this lovely Thursday, and we're going to keep it moving. All right, getting ready to begin your nursing career. I'm going to talk about a department that a lot of people tend to be a little scared of, especially new grads. But over the past 3 or 4 months, that has changed. And the reason why that has changed is because pretty shortly, I'm going to introduce you to two of my cardiology managers that's going to explain to you more in depth about the cardiology departments that they are managers of. And I'm going to say this, once you start your career with HM, no matter what department it is in, you will be glad that you did. So let me tell you a little bit about HM Health Wake Forest Baptist. As you can see on this slide, we have approximately 21,581 teammates, which is a lot. We have 7 hospitals. Also, we have 11 urgent care locations with 2 additional locations being under development at this time. We also have 6 emergency departments, 28 cancer care locations, and as you can see, the net operating revenue for HM Health Wake Forest Baptist is at $4.3 billion and growing by the year. Also, just a little snippet about a 24-hour day look at what happens at HM Health Wake Forest Baptist. We usually have around 11,800 patient encounters, 175 surgeries, 13 babies delivered, 6,476 physician visits, 329 virtual care encounters, and in the emergency department visits, 652. That is a 24-hour synopsis of what goes on at HM, and that should tell you that we are always working, making sure that we take care of our patients each and every day. So it's a good one for me. Locations. I'm going to start off with the heartbeat of our organization in North Carolina, which is the Winston-Salem campus, which is the heartbeat. And it's a maze, but we at the Winston-Salem campus, we do have 885 beds. Now, if you're thinking about going to High Point, North Carolina, which is the furniture capital of the world, so when you do start working with us, you got the furniture places there for you to furnish your apartments. They have about 351 beds. Now, if you are one that likes the outdoors, like the mountains, the North Wilkesboro Hospital campus is the place where you want to be. They have 130 beds. Also, Lexington, North Carolina. I know some of you probably heard that that's the barbecue capital of the world. So if you are a food junkie and you love some barbecue, Lexington, which has 94 beds, would be the great place for you to start. And also rounding it off with our locations, Davie Medical Center, which is pegged the country club of our locations. It's a small, intimate hospital. I think it's one of the newest hospitals, and it has 50 beds. But no matter where you start, It's going to be a great start for your nursing career. And today we're going to get on cardiology to let you know that will be a prime location for you to start your nursing career. And at this moment, I'm going to turn it over to two of our illustrious cardiology managers. We're going to start with Miss Bianca Dunlap. She's going to introduce herself and be able to answer some questions that you put in the chat. So without further ado, take it, Miss Bianca.
Hi, good afternoon. I am Bianca Dunlap. I'm the nurse manager for Cardiology 7 Reynolds, which is an intermediate step-down unit. I've been a nurse for going on 18 years this year, all at the Atrium Wake Forest Baptist location. And believe it or not, I started out my nursing career in a surgical background, went to med surg where I obtained the certification, and then I went to cardiology. Cardiology at that time seemed to a bit intimidating. However, when I got here, it was quite the opposite. How about you, Jennifer?
Hey, thank you, Gary, for the introduction. And Bianca, much like you, I started my nursing career in med surg, and I've been a nurse for 11 years. I worked on a medical surgical unit in a small hospital. And one night I was taking care of a patient and I recognized some changes in her heart rhythm. She was not on telemetry at that point, but just by listening to her, I recognized a change. And when I contacted the physician that night to get an EKG, it turned out she was an AFib. Um, this piqued my interest on cardiology even more. It was my favorite subject in nursing school, but as most people are, when you're studying cardiology, it's a very intimidating area. And I never thought I would ever be able to do cardiology. I didn't think I was, smart enough or skilled enough or knew enough about it. But that piqued my interest. I transferred to a cardiac step down unit shortly after this event took place, and I have been in cardiology ever since.
So why cardiology? We've heard Jennifer's reason as to why she selected cardiology, and very similar to hers, a lot of my teammates and I feel the same way. Cardiology, without the risk of sounding cheesy, is just something in your heart, just kind of draws you to that area. And it's very similar to putting together pieces to a puzzle, except you're not doing it alone. There's a lot of teamwork in cardiology, and there are very intelligent people in cardiology. And there are some things in cardiology that is definitely worth a life learning process. So you develop all types of relationships with everyone at different skill levels, whether it's physicians or it's nurses, nursing assistants, or even people in other disciplines as well. But cardiology, studying cardiology can be very beneficial to you because everyone has a heart. And no matter where you go in your nursing career, you will learn from cardiology how to take care of all types of patients. So you can take that skill anywhere you go in nursing. Cardiology is a very fast-paced floor, and it can be a very rewarding floor as well because a lot of your patients will recover somewhat quickly. However, some of your patients will spend months with you on the floor if they're waiting on a heart, as an example. But wherever you go in cardiology, if you practice at Atrium, you will definitely be on the cutting edge of a lot of technology. We're studying new things all the time, new processes and new methods. And it feels very good and rewarding to be a part of those things, new devices, and always a way of how we can make it better for our patients.
I'm going to
So,
talk a little bit about what we see. I'm sorry, Bianca, I didn't mean to cut you off.
fine.
I'm going to talk a little bit about the units and what we see on each of the units. We do have two medical interventional cardiology step-down units. That's going to be our 7 Reynolds Tower and 7 Ardmore Tower. These are both step-down units. The types of patients you're going to see there are patients who have had a heart attack. They come in, they get a cath, they get stents, pacemakers or ICD placements. Some of these patients will have ablations. So the pacemakers, the ablations are more electrical procedures. So those are going to happen in the EP lab. A good bit of the patients are heart failure patients. They've been diagnosed with heart failure. We're managing heart failure. It can advance to where they may need an LVAD or a left ventricular assistive device. This is basically a motor that runs the heart for them until they can get a heart or a heart transplant. We have patients that come in just to rule out chest pain or to rule out an MI or a heart attack. We do the TAVR is a valve replacement that we're able to do through the femoral artery, mitral clips as well, cardiomyopathy. And on 7 Reynolds specifically, they do handle SWANs and LVADs. The LVAD, again, is the left ventricular assistive device. Very interesting to work with these patients. These are long-time patients. They stay on the unit for a while. Sometimes they are readmitted to the unit. And then for 5 Reynolds, these are going to be the patients that have had the heart cath, been diagnosed with multivessel disease. And so these are going to be patients that come in for, a cabbage, which is basically where we reroute the vessels of the heart to feed the heart more blood flow, valve replacements and repairs, new LVAD placements, and heart transplants. These patients can also have aortic aneurysms or abdominal aneurysms, carotids, thoracic outlets. These are all open heart. Other than the thoracic outlet, they actually go through the side for that. But all of these are open heart procedures, and we receive them on our step-down unit post-op day 1 or 2. One of the questions I see is, do you have to have experience to work on certain units? These 3 units are actually very good units to start on and to grow on. So these units are good places to start, meaning you're not going to learn everything overnight. It's going to take time. And as a new grad or a nurse transferring in and, not knowing cardiology, it's going to take you time to learn, but the team is there to support you. And every day you're going to learn something new. You're going to pick up on something new. This is also a good place to grow in and stay in. Cardiology has so many opportunities within the department that as you start advancing yourself, there's going to be many opportunities for you to grow.
Yes, and Jennifer and I have both worked on all of the cardiology units, 7 Reynolds, 7 Ardmore, and 5 Reynolds. So we can definitely give you the support that you may need in order to grow and make it a little less intimidating. And 7 Reynolds takes part in a nurse well-being program called Stress First Aid. And we have an organized way to recognize stressors in our teammates, as well as get and give feedback during those times of stress. So again, we're really concerned about our teammates and concerned about the patients as well. So orientation for these units are generally around 12 weeks. 7 Reynolds uses a merit state model for their orientation, meaning that you and your preceptor will share the same assignment. And whether it is a 1-to-1 ratio, 1-to-3, 1-to-4, or 5, you and your preceptor will go in each room together until you're a little bit more comfortable. That way, it seems like a natural progression for you as you continue on through your orientation. All of our preceptors go through a Core Connect module class where they are certified to become preceptors, and they are definitely there because they want to be there. They are trained on giving feedback and giving feedback on your performance as well as on the health conditions. We will check in regularly with you during your orientation to assist you in getting all of your skills completed during that 12 weeks. In the event that you need a little extra time, we can definitely make that 12 weeks a little bit, tailor it a little bit more toward you and what you feel that you need so that you can be confident in working on your own towards the end of your orientation.
All of these units have excellent teamwork. As I mentioned before, you're gonna learn things along the way, and we have so many different levels of nursing in each of these units and levels of experience. So we have nurses anywhere from a year being a nurse all the way up to 20 plus years being nurses. So obviously, we're going to learn from those who have been there for a while. The newer nurses are going to bring newer things into the unit. So, as a team, we are working together to give better care, to learn off of each other, and to help teach each other. It is a teaching hospital as well. You're going to be able to pick the brain of a doctor or some of the APPs, the advanced practitioners, to learn more about what's going on with your patient. Um, and you'll find in cardiology that once you get in cardiology, it's a tight knit family. It's a tight group, but within cardiology, lots of places to move and grow.
All right, all right. I'm gonna slide over onto this next slide to speak about some of our benefits that we have at Atrium Health Wake Forest Baptist. One good thing that I do love is benefits start day one of employment. That is huge, especially for some of you new nurses that have some kids and have families. Having benefits day one is huge. We also have up to $2,500 a year for a bachelor's degree in case you want to go back to school to get that after having an associate's. Also, um, sign-on bonus. I know a lot of times being in recruitment, a lot of nurses and new grads ask about the sign-on bonuses. We do have up to $15,000 sign-on bonus eligible position, especially for cardiology. Cardiology has a $15,000 sign-on bonus, which is paid out in 90 days, 1 year, and 2 years. Also, a question that has arose about the sign-on bonus is if you are under a contract. No, you are not. You will get paid your sign-on bonus as you work out the entirety of your sign-on bonus time. So I know there have been situations where other organizations have made them pay back, but we don't do that here at Atrium Health Wake Forest Baptist. Also, PTO, we have a great PTO system. You have a PTO max of 200 hours per year to begin. And also you get up to 6 weeks of paid parental leave if that is a necessity for you. And we do have discounted tuition at participating schools. But I will say this, the benefits here are top notch. I can give you an example myself from where I used to work. The benefits here are so much greater. And one thing we do pride ourselves here at Atrium Health Wake Forest Baptist is we really focus on the culture, the work-life balance, and the benefits for all of the employees. Next slide. There we go. So I know that Jennifer and Bianca are being a little modest today, but I want to talk to you guys real quick about these two. Cardiology is a great department to start your career. I went over there and visited the department a few times, and from what I gather, like Jennifer said, that's a tight niche family over there. One of our managers couldn't make it today due to personal family reasons, but these two young ladies right here, from where we started a year ago to where we are now, they have done a tremendous job with those employees. I even get emails from new grads, from current employees to say what a wonderful department it is for to work for Bianca and Jennifer over there in cardiology. And I would say this, if you decide to start your nursing career, take a look at cardiology. If you have any questions for me down the road, like I said, on the slide, you have my contact number and my email address. And if there aren't any other questions, I think I see someone typing something in the chat right now.
There's a question from Bethany. Are
Mhm.
these the only unit positions in cards you're recruiting for? Are you looking for a member of leadership or a case manager within cards? Um, I am not aware of a position open right now, but I can tell you that the cardiology department is going to be growing. So if I were you, I would send Gary your resume just so he can have this and he can get it out to some of our higher leaders. They are going to start hiring for this new department. So it is something that I think is worth looking into. Even if there's not a position posted, I think Gary would accept the resume. Am I wrong?
That is correct. What you would need to do is go on our web. First of all, you can reach out to me first, and I will help you find whatever department or area that you are looking for to start your nursing career. Okay. Like Jennifer said, we are going to have some other departments that are opening, and my job is to make sure I guide you in the right direction. So as you can see in the chat, Madison did put my email address and my contact number. And also, if you guys want to talk directly to Bianca or Jennifer, their information is in the chat room as well. So at any given time, I'm here for you guys. I must say this saying right here. I tell my candidates and applicants, I work for you until you start working for your manager. So that just tells you I'm here for you 24/7. Okay. I do see another question from Shantika. She said, I know Gary spoke on the different locations. Can I ask what location do you all work at? You want to take that first, Jennifer?
Sure. Both Bianca and I work on the Winston campus. There is a cardiology department in High Point as well. But the largest portion of the cardiology department is on the Winston campus.
See, I see one more. I am interested definitely in nights. Do you have Baylor open or just weekends? Not sure. Is that day or just weekends?
Typically, we rotate through weekends. So I know for 5 Reynolds, we schedule in a 6-week period. So within 6 weeks, so this happens on 7 Reynolds and 7 Ardmore as well. In a 6-week period, you're expected to work 4 weekend shifts. So that can be a Saturday, Sunday, 4 Sundays, 4 Saturdays. And then we ask that you work 2 Mondays and 2 Fridays. We do have situations where we're able to make arrangements if other people are able to trade with you. We also rotate through holidays. So and I cannot speak for the other units. I do think we still have maybe a couple of day positions open and nights. Is
7
that correct,
Reynolds?
Bianca?
Correct. 7 Reynolds still has 2-day positions available, and we mirror the weekend and holiday schedule, as Jennifer just mentioned. So if you are interested in a day position, please go on that website and fill out the application or contact Gary or myself, and we'll be happy to set you up with an interview.
And to answer Dana's question, yes, you can just work weekends. There's actually a special job code for that. So anyone who just wants to work weekends, which is going to be Friday, Saturday, and Sunday night, because you specifically mentioned nights, you will get your base pay for the nights, and then you get more pay on top of that for being a weekend nurse.
If someone was wondering what the night shift diffs were, I can give you those right now. The shift diffs are 3P to 11, $4, 11P to 7.5, and on weekends, Friday, 7P to Monday, 7.8 is $4. So you would get shift diffs added to your base rate of pay if you're on nights.
When does the application cycle open for the nurse residency program for December grads?
I would say that'll be a question that I can answer. I can help answer. It's a little early right now for the December residency program since we are in the process of processing all of our May new grads. But I would recommend and tell you guys, go on our website every day because there could be a position that we could be posting that is available that you might be interested in. I know we're talking only about cardiology right now, but the best thing I say for you to do is contact me right away. And I will
Yes.
walk you through all these processes. I will get you to the person that you need to speak to. I also will get you set up for interviews for Bianca and Jennifer as we speak, and then we would just go from there.
Yeah, I would say after this summer rush, we can start working on accepting applications for December grads. And you can always send these resumes to Gary, Bianca, myself. And is there any way for us, Madison, to add Angie's email to this as well?
Yes, one moment.
While Madison is adding that, I would add this. Atrium Health Wake Forest Baptist is an academic healthcare system that kind of sets us apart from a lot of other organizations. And there is a plethora of room to grow here. We just merged with Advocate Health about a year and a half ago with the Midwest, and things are going really, really fast. And we would love for you guys to come on board. The onboarding process is as smooth as can be. You will be looking at about from when you accept an offer, you'll be looking at about 2 weeks to start, as long as you get done and get all your onboarding tasks completed, and we can get you going right away. And like I said, Atrium Health Wake Forest Baptist, if we're not on your queue, we should be on your queue right now.
Mhm.
I see a question here. What is the most desirable trait in a candidate you're needing in cardiology? For me, I look for a candidate who has heart, who
Mhm.
wants to help people, and who has um, the desire to learn. Those are the people that I'm looking for. I want people to mesh with the group that I already have on the unit. We have an incredible team, but I need people to care for our patients. We are all there for the same reason, and I need people to really care about our patients. We are taking care of heart patients, and we have got to give them a certain level of compassion. They're going to feel that. And when they feel
Mhm.
that, they get better. The good thing about cardiology is we get to see our patients get better and go home. It is not 100% of them, but I would say the majority of our patients get better and go home. We are able to treat them. We are able to send them home to their families.
Yes, I agree with Jennifer. You have to have heart in cardiology. I know I've said that before, but at the risk of being cheesy, that definitely is what you have to have is the ability to care for people as if that was your family member laying in the bed. And you have to be positive. People can feel the positivity coming from you and how much you care about their progress and how much you care about them as an individual. That is what we're looking for, someone who's a sponge, someone who wants to soak up that knowledge and soak up just the culture around them and being positive in how someone's can go, but also making sure that you're able to retain that information and act quickly and make sure you know exactly what to do. Don't be afraid to speak up if there's something that you don't understand. Don't be afraid to ask any questions. Our environment is one that fosters questions. We are a learning institution, as someone mentioned before. We have a culture of questioning. We want someone who's comfortable with asking those questions.
There's also a question here about certifications you can earn. There's many certifications you can earn. As far as a step down level, we've got a PCCN certification. If you move further up into critical care, there's a cardiology critical care certification. We have a clinical ladder program. The clinical ladder is basically a program that the more involvement that you have, the more certifications that you have, the more that you are invested, the higher pay you get. And so you get advancements
Mhm.
in pay based off of how far you climb on this clinical ladder.
So at the moment, do we have any more chat questions that want to be answered by any of the people on the call today? All right, all right. Well, I want to go ahead and thank everyone that joined us today for our talent talk to highlight our cardiology departments. I want to thank Miss Jennifer Grubbs and Miss Bianca Dunlap for taking time out of their time to answer some questions that some of the new applicants do have that could possibly be coming on to our organization. And I also want to thank Madison Quinn and Lauren Russell for facilitating this and getting us set up to be able to get you guys all the information you need, whatever questions need to be answered. And we just want to make sure that you have a smooth transition to whenever you decide to join Atrium Health Wake Forest Baptist, we'll be right there for you. So without further ado, I guess we're going to call it a day and thank you guys so much.
Thank you. We can't wait to see you all.
That's right.